Namaste. Good evening, all. So, myself Lakshmi. I'm a yoga therapist from Bridge Health. So, I have pursued MSc in yoga therapy and right now continuing with my PhD in yoga for the women's health. So, today we are celebrating the World Lung Cancer Day. So, as part of that, we Bridge Health are performing a yoga session based on pranayama. So, in this session, we will be explaining the benefits of pranayama and few techniques that you can do in your day-to-day life. So we'll wait for a few more minutes. We'll try to wait for a few more minutes, around 2 minutes more, and then we'll start interviewing. So today's pranayama session, it will be mainly focused on how to improve the lung capacity. So there are certain practices which directly connected with improving the lung capacity. So one of those practice is the sectional breathing, which involves a set of exercises starting from the lower lobes of the legs, middle lobes of the legs, and the upper lobes of the legs. So these practices helps to improve the capacity of the lungs by improving the quality of your breathing. And there are some other practices like a Nadishuddhi pranayama as well as a Brahmari pranayama. So Nadishuddhi is the common or the general form of pranayama that can be practiced by all participants. There is no contraindications or direct side effects relating to this sort of pranayama. But again comes with the Brahmari. Brahmari is also a general pranayama that can be practiced with all the participants, but it has to be done under proper guidance. There are some initial techniques that you have to adopt within yourself before practicing this Brahmari pranayama. But the Nadi Shuddhi is the very common pranayama that can be adopted by anybody in your day-to-day life. And also practicing pranayama, you have to make sure that you are not doing it immediately after your meals. Not even the pranayama, any yogic exercises that you have to perform at least 3 hours prior to the meals. Or else, if it's always better if you can perform in the early morning, or else in the early evening times, like the 5 to 7 p.m. in the evening, and morning it will start from 3:30 a.m. in the morning till 8 in the morning. So these are the prescribed time for doing the pranayama. So just because that our stomach will be empty and you will be getting the full benefit out of it. So today I'll be explaining only the three pranayama. So first one is the sectional breathing, Nadishuti pranayama and the Brahmari pranayama. Sectional breathing, as I told, it's there are studies that is showing that there is a significant improvement in the lung capacity of the participant after performing this sectional breathing. And Nadishuti pranayama help to balance your prana. You know that if you're just sitting normally without much stress or something, you can place your palm just close with your nostril. You can feel that only one side of the nostril will be breathing actively, so which shows that your prana is not balanced. Only one side of your prana is balanced. So this sort of pranayama, nadi shuddhi or the balancing pranayama, help to balance your both nadis. So as per the science, there are two forms of nadi within us. So that is the Chandra nadi as well as the Surya nadi. So Surya is the right and Chandra is the left. So these two nadis has to be balanced in order to free from all the disorders. If any of our nadis are not balanced, over Chandra nadi is the left nostril. So if the left nostril is not balanced, you are not breathing properly through your left nostril, which means that you can't relax normally. So the relaxation of your body will be very difficult. For example, if your Surya Nadi, that is the right nostril, if the right nostril is not balanced, it is disturbed or it's not breathing properly, which means that you will be so active and you won't be able to finish any of your works. You will be more stressed out because you're more anxious, and the blood will be more rushing towards your nervous, more rushing in your nervous system, and you won't be able to focus on anything. So that is the disturbance which happens with the right. And with the left, it will be again, you won't be able to relax it normally. By balancing these two nadis, we can make sure that your body is balanced and you can focus on whatever you are into it. Okay, so I think we can start with the practices. So first we'll do with the sectional breathing. Sectional breathing first with abdomen breathing. You have to adopt chin mudra in your left palm. So that is the index and the thumb finger, which has to be coming closer. You can place it on your knee, and the right palm you can place it on your abdomen. So now with inhalation, you are expanding or you're bulging your abdomen. Now while exhale, you are sinking your abdomen. Inhale, bulge your abdomen. Exhale, sink your abdomen. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale down. You can release your palm. Eyes remain closed. Normalize your breath. Gently open your eyes. So the second practice in the sectional breathing is the thoracic breathing. So for that you can adopt Chinmay Mudra. You can bend your both fingers, the index and the middle one, and you can close it with your thumb and place your right palm over your chest region. Always make sure that your spine is straight while doing pranayama. You're not hunching your spine. Your spine should be straight. Palm on your chest. Now take deep breath in and you're expanding your chest. You have to feel that movement happening in your chest. Exhale down. Inhale up. 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 Exhale down. You can release your palm. Eyes remain closed. Normalize your breath. Gently open your eyes. The third practice is the clavicular breathing. So for that you have to adopt Adi Mudra. You have to make a fist of your palm. Place your Thumb inside and close it with your remaining fingers. Place it over your knee. Right palm over your left shoulder. Here with inhalation, you are lifting your clavicular bone. It's not like completely you're lifting it up. With inhalation, it's a slight movement happening. Exhale, your collar is collapsing down. So you have to feel the movement and bring all awareness on your clavicular. Inhale up, exhale down. 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 Drop your palm down. Eyes remain closed. Relax yourself. Gently open your eyes. So the last set in the sectional breathing, it's the full yogic breathing. So these three practices will be combining the same Adi Mudra. You have to adopt in your both palms and place it on your navel region. So this is the final step in the sectional breathing. Make sure that your fingers are touching each other and you're slightly giving a pressure on your navel region. So with inhalation, you're expanding your abdomen, your chest, and your clavicular. While exhaling, bring your shoulder down, collapse your lungs, as well as you have to suck your abdomen. Okay, we'll do together. Close your eyes, spine straight. Inhale up, exhale. Inhale up, exhale. Inhale up, exhale down. 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 Eyes remain closed. Release all the mudras. Thumbs on your knees and relax for a while. Try to observe the changes happen within you. You can feel the slowness in your breath, the relaxed breathing. You can gently open your eyes. So this all four practices form the sectional breathing. So the first one is the abdomen breathing, thoracic breathing, and the clavicular breathing. And the last one is the full yogic breathing, combining these three practices. And the three practices, we have three mudras, starting with Chin Mudra, Chinmay Mudra, Adi Mudra, and the Brahma Mudra. Okay, hope you all remember the mudras before practicing this thing. So the second practice, the second set of pranayama is the Nadi Shuddhi pranayama, which doesn't have any contraindication. All the participants are free to perform this pranayama, but make sure that you are not doing it immediately after your meals. Make it at least three prior or like 3 hours after your meals, and we'll practice the same again. Chin mudra in your left palm, and Nadi Shuddhi we have to perform with Nasika mudra. So the index and the middle finger will be folded. So we will be using only our thumb and your ring finger, that too of your right palm. Okay. Always start with your left nostril. Make sure your spine is straight. Close your eyes. Close your right nostril with your thumb. Just follow the instruction. Inhale through left. Left closing with your ring. Right exhale. Right inhale. Right closing with thumb. Left exhale. Left inhale. Right exhale. Right inhale. Left exhale. Left inhale. Right exhale. Right inhale. Left exhale. Left inhale. Right exhale. Right inhale. Left exhale. Drop your palm down. Eyes remain closed. Relax yourself. Now your both nadis have been balanced. Balancing your right as well as your left nostril. Try to observe the change within you. Eyes remain closed. Begin slowly open your eyes. So this pranayama, there are many benefits for the Nadi Shuddhi pranayama. So the first one is it will help to calm down your mind. So thereby it has shown the scientific proof of reducing the stress hormones or cortisol levels by balancing your both nadis, Chandra as well as the Surya Nadi, and you have to adopt Chin Mudra left palm and Nasik Mudra in your right palm. So these are the two mudras for performing Nadi Shuddhi pranayama or the balancing pranayama. Okay. So we are coming to the last pranayama, so that is the Brahmari pranayama. So Brahmari pranayama we are practicing by producing a humming bee sound. So this pranayama you have to perform With two mudras, either you can do it with your chin mudra or else you can do it with your shampoo mudra. You have to close your ears with your thumb and you have to press it with your thumb, and the remaining fingers you can place it one over your eyebrow and the second one on your ear, eyes, nose and your lips. So this is the mudra. So this you have to adopt with your both thumbs. Okay, so if those are having any difficulties in lifting your arms up, you can free to use chin mudra, so this will be the more comfortable. You can go with this as well. So for this practice, the tip of your tongue you will be placing on your upper palate and you will be producing the sound nakara. It's not makara, it's nakara. I'll show once. Taking deep breath in. Okay, so this is the sound you have to produce. So by touching your tip of your tongue on your upper palate, automatically you will start getting a resonance or a vibration throughout your head region. So that you have to observe. We'll do this practice for 9 rounds. Okay, either chin mudra or else this mudra. Take deep breathe in. 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 You can absorb the vibration. Eyes remain closed. You can feel the vibration throughout your head. Now you can gently open your eyes. Hope you all enjoyed the practices. So this was a primary pranayama, which helping improving your sleep quality as well as reducing the stress hormones. So thank you all, and I'm open for the question and answer session. So in case if you're having any doubts relating to the yoga as well as the pranayama session, you can go ahead now. So whatever practices we have done today, there are no contraindication as I have to. You have to, if you are a complete beginner, try to start it with a trainer, a proper yoga instructor to get into involved with any other mistake or something if you are involving. So he or she will be able to like guide you through the initial stages of the pranayama. Or if you are not a beginner, of course you can do it with your daily lifestyles. If you're beginner, try to go ahead with a proper instruction based. And always make sure that whenever you're starting with pranayama, it's not directly you're coming and sitting and doing it. Make sure you sit for a while. And the place you're choosing for the pranayama, it can be a little spacious. If possibly, if you can do in an open air space, that will be the more comfortable one. And if possible, you can keep it like a less, not a loud environment. You can keep it a low sound environment for getting the more benefit out of it if you're starting, if you're in the initial stages of the practice. And the meals thing I have told, and you have to keep it at least 3 hours. And it's most preferably like early morning is very good for doing the pranayama, so that the entire day you will be feeling the benefit of it. Any questions? And there are other sets of pranayama like Kapalbhati, Bastrika pranayama. So these are the pranayama, they have very good scientific benefits for the asthma as well as the cardiac health. But there are some contraindications such as those who are having the back pain, those who have done immediate abdominal surgeries, or those who are having high BP. So these participants, there are some contraindications to avoid these sort of pranayama. And those who have gone with this, any heart surgeries or having any heart block issues. So those practitioners are not allowed to do this Kapalbhati as well as the Bastrika pranayama, but they have a lot of benefits in improving your lung capacity as well as improving your cardiac health. Any questions? You can come up with any questions, not even exactly relating to the pranayama. You can ask the question relating to the yoga as well. So pranayama is basically we are practicing either at the starting of the yoga practice or else at the end of the practice. Usually in the different styles of yoga, like if you're taking the Shivananda style, we will be starting the session itself with the pranayama, or if you're taking the normal hatha yoga, it will be the end of the session we will be practicing the pranayama. But both are okay. It's a good way to keep in your asana practice. Make sure that whenever you're doing a yoga asana session, make sure to include one or the two techniques of the pranayama to balance your prana. Okay, so Fissa Afrin had one. This was a nice session. I have asked, is it okay to practice this breathing exercise? Yeah, that's what I have mentioned. Those who are having asthma, they need to avoid only the two practice, Kapalbhati and Vastrika, which we haven't included in this session. So whatever we have practiced today, so that is sectional breathing, Nadi Shuddhi and Brahmari, these practices are very good for the asthma patient. Even though it is good for the patient, but before trying it out, make sure you are doing it very slowly. And in case in middle of this, any of the session, if you're feeling any sort of difficulty in breathing, immediately stop the practice. But it is a very rare case, but it's completely fine for the asthma patients to go for it. How many times should we do this daily? See, so what we have done this hardly we have taken around 20 to 25 minutes. So in a day you can spend around 25 minutes for your breathing practices. Not fully you have to take the 25 minutes. Any of these one practice you can include it in the yoga session. So suppose if a yoga session is for a 60-minute session, in that 15 minutes you can contribute to the pranayama and the remaining you can go with the asana practice as well as the warm up and the relaxation. So this you can, if you are only practicing the pranayama, you can do it at least for a 25 minutes in a day. Most of the time I feel my nostril blocked. How do that? So nostril blocked, that's what I told. There are other sort of pranayamas like vastrika, not vastrika, it's exactly like cooling pranayamas. So those pranayama you can avoid whenever your nose is blocked. Cooling pranayamas can be avoided. Instead you can go with the kapalbhati, which I have mentioned. So it's a technique like you have to inhale as much as possible and then you will be exhaling, like, so this sort of pranayama which help to clear your nostril or else the pathway. Okay, so again I had told this pranayama is having a contraindication. Those who are having the back pain or those who have gone through an immediate abdominal or a back surgery, they should not go with this practice. Thank you all. Any other doubt? I hope everything is clear for everybody. Um, we'll conclude here. You can sit straight. We'll conclude with one Omkara and three Shanti. Join your palm, keep your eyes closed. Breathe in. Shanti, Shanti, Shanti. Rub your palms. Warmness on your face. Open your eyes, look at your palm with a smiling face. Thank you all. Have a great day.